These are in listen-only mode.
Welcome, everyone. My name is Pamela Shaw, and I'm here to introduce our esteemed presenter for the first in a series of webinars with future installments to be announced on pulse diagnosis. Michael Tierra is an herbalist, teacher, author of The Way of Herbs and Planetary Herbology, mentor, acupuncturist, musician, poet, amongst many other hats. Thus, it is my pleasure to turn this over to Michael so he may begin sharing his knowledge of pulse diagnosis. Welcome, Michael.
Thank you, Pamela. And I'd like to thank you, all of you, for attending. And there's many other people, I think, who are going to be coming as well. But so far we have about 116 of you on. And so pulse diagnosis represents one of the great mysteries and challenges in traditional medicine. It's most commonly associated with traditional Chinese medicine, as well as Ayurvedic medicine and Unani medicine, which is Middle Eastern medicine that is actually quite based on Ayurvedic medicine, and is actually the sometimes called Greek medicine because it actually was the beginnings of our own ancestral Greek tradition. And there's quite an overlap in the theory and principles between Ayurvedic and Greek medicine. Most people know that the pulse reflects the heart rate, which is normally between 60 and 90 beats per minute. Whether it's too slow, too fast, or irregular can indicate a possible heart problem. However, according to traditional Chinese medicine, the pulse reveals more than just the heart rate. It's an extremely complex subject and an important diagnostic tool, and this is why we take pulse readings much longer than you normally experience at a Western medical office. The following will introduce some concepts of Chinese medical pulse diagnosis. When we take pulses, we try to align ourselves in a way that we're shaking hands with the individual in front of us. So it's really is a getting to know you kind of diagnostic method. And sometimes some practitioners have a very comfortable pillow that the person can rest their wrists on as you're feeling their pulses. And you reach your 3 fingers of your hand. It's going to be your index, middle, and ring finger. So if you're shaking hands with the right hand, with your right hand, you're going to reach your left hand around. So you place your index finger right next to the thumb on the inside of the arm, on the radial pulse, and then the middle finger right next to it. There's a little bump there called the styloid process. And the ring finger is in the little dip that is right next to that. Now, what I'd like you to all do is hold one arm up in front of you, and I'd like you to take your other hand and reach around and put your index finger on the space just below your thumb on the opposite wrist, and your middle finger goes on the little bump called the styloid process, and the ring finger goes in the depression just further away from your hand at this point. So each of these are a finger width apart. Now you should be feeling a pulse there, at least if you're, number one, if you're in the right position, and number two, if you're alive. And I trust that all of you are alive. And the remarkable thing is that you're feeling initially two qualities. You're feeling the actual quality of the pulse itself, its rate of speed, whether it's regular or irregular, the strength or the force, and there's going to be other things that we'll talk about. But we also are going to be learning the second qualities, which are that each of these finger placements represent 2 distinct organs for each finger placement. Now, this seems a little counterintuitive to think that on the same artery within an inch and a half, essentially, that you're going to have on one arm a representation of 6 organs, and on the other arm a representation of a distinctly different 6 organs. We'll get into the meaning of all of this, because that particular aspect of pulse diagnosis is has been the subject of controversy that has actually gone down through the ages. But the overall quality, which is the first thing I want us all to focus on as we're talking about the various qualities of the pulse, is something that I would like you to try to analyze right off the bat. And that actually is going to be the most important quality, and the qualities that appear in each of these other positions we can consider to be of lesser importance unless they show themselves as being prominently different in some special way. Or let's say that is the gateway to a more subjective understanding of the person who you're working with. So pulse diagnosis is important for two reasons. It can give very detailed information on the state of the internal organs, and it reflects the whole complex of qi, blood, yin, and yang, and frankly, every part of the body. It gives the doctor an indication of the overall constitution of a person, just as the tongue can reflect these phenomena as well. And after we've completed this series on pulse diagnosis, Leslie's going to do a webinar on tongue diagnosis, which will be a little bit easier to get because it's visual. Pulse diagnosis is a very subtle skill. We take the pulse on the radial artery, dividing it into 3 sections as I described, and detecting it at 3 different levels. For the first level is when your finger just touches the artery. The second level is, and then there's the deep level, and the middle level or moderate level is a space in between. Let's see here. We're going to be learning various distinct and overlapping approaches. So as I talk about different qualities, don't think of these simply as separate things, but they're overlapping each other, and sometimes they're just another way of saying the same thing that was said previously. So we're trying to get a feeling as well as an understanding of these different qualities, and sometimes describing how something feels doesn't actually give you the feeling. And so it's important to actually feel the pulse, and before you get any proficiency at it, you have to really make a commitment to feel pulses on a regular daily basis over a period of time. Usually in that regard, when I'm working with students on a direct face-to-face level, I try to tell them, as I did when I first started learning pulses, is to make a little chart and make it a point to feel 5 pulses every day, and write down what you feel in each position and overall. Make it 2 distinct things, and write that down. And when you first start out, you're going to think you're making it up, and it sounds crazy, because unless you have a frame of reference of feeling several pulses, you won't be able to tell the difference. So start out doing the best you can, and after a period of taking several pulses, you're going to find that there's qualities that you're feeling that have a lot more relationship to each other, and you'll understand more what it's about. Backing up a little bit, the historical background of pulse diagnosis is as rich and as old as you can imagine the history of medicine would be. In terms of traditional Chinese medicine, which is going to be the major system that we're going to be relating to, everything in Chinese medicine that has any validity relates to the Yellow Emperor's Classic of Medicine, which dates to 300 to 100 BCE. The Nanjing, which is a classic of difficulty, specifically deals with acupuncture, and that was written between the 1st and 2nd centuries in the Common Era. The Meijing, which is a very important text on pulse diagnosis, was written by Wang Shuhei, and it is translated today, and it was written in the 2nd century. And it actually is the model for what the modern understanding of pulses is, because he named 24 specific pulse qualities and associated the Sun Ko and each specific Sun Guan Qi, which are the 3 positions on the wrist. The Bin Hui Mai Zhui by Li Shen, one of the great figures in medicine throughout the world, because he dedicated his lifetime of going through the mountains and cataloging information on all the herbs in China that he could, which numbered hundreds, and gathering data that of the local usage for each herb. And this is Li Shen's Pensao is considered to be one of the great achievements in medicine. He wrote a book on pulse diagnosis in 1564 BC, and was a summation of all the pulse knowledge extant at the time. Avicenna, one of the great masters of the Western herbal tradition, even though he was Persian, he wrote almost 450 treatises on a wide range of subjects, and his most famous books were the Book of Healing and the Canon of Medicine. He said, towards this remarkable endeavor, pulse diagnosis has provided a primary means of knowledge regarding the inner workings of the human being since the burgeoning core of civilization, both before and west, and both east and west. Very interesting character was Sanctorius, who 1561 and 1636. This guy was really fascinating because he, for 30 years, he created this weighing box, and he weighed everything. He weighed himself all the time, every day, everything he ate, his urine, his feces, and he tried to compare the weight of what he had eaten to that of his waste products, the latter being considerably smaller because, of course, we were burning up some of it. And it gave rise to the theory of insensible perspiration. That was the theory of that time. But this is considered to be one of the first studies of metabolism. As you can imagine, a guy who has such a penchant for weighing and measuring everything would try to apply the same to other observations, including the pulse. And he refers to a man named Flayer, and he says, for many years I tried the pulses by minute in common watches and pendulum clocks when I was among my patients. And after some time I met with the common C-minute glass, which I use for my cold bathing, and by that I made most of my experiments. Sir John Flayer, I don't know if you've ever considered what it must have been like to take the pulse when you didn't have a watch with a second hand. Well, anyway, Sir John Flayer invented a watch to measure the rate of the pulse, and he wrote a book called The Physician's Pulse Watch. And to show the influence of Chinese medicine in the West, Sir John Flayer lived from 1649 to 1734. In this book, he was particularly intent on trying to understand what the Chinese are feeling when they feel the pulse. Chinese pulse diagnosis was first described in the Emperor's Yellow Classic and later in the Pulse Classic. One Chinese doctor, 1693, 1771, Xu Dachun, produced a chapter on the pulse. And he said if the pulses were in harmony, it meant health. If there was discord, it meant disease. Even in those days, well, there was another famous doctor named Dr. Zhang Zhongjing, who in antiquity often made admonitions, and one was that he said, even those who practice medicine do not carry out pulse diagnosis with utmost care. They will not be able to save lives even with the greatest skills of their 3 fingers. Unfortunately, today's physicians know nothing about the pulses and do not take care when they write a prescription. No one knows how many patients they have killed with their therapies. Now, we're talking about somebody who lived back in the 3rd century saying that something was lost. So, in other words, pulse diagnosis has presented a challenge to everyone and to all ages. And only a few people claim some degree of mastery with it. So moving on, and today, pulse diagnosis continues to evolve. Modern literature demonstrates that there are alternate pulse positions. And Tao then identifies the 4 methods of lifting, pushing, pressing, and rolling. This means that when you put your finger on your, well, go ahead and put your hand on your pulses again as you did when we first began, wrapping one hand around the other and putting the pads of your fingers against the radial artery. And try each of these methods. As you're pushing, as you're holding down the artery, you lift it and see how fast it comes back. Then push on it. In other words, push it forward or push down on it. See if there's anything there, and if there's any resistance. You can press on it and see if it goes away or if it becomes actually stronger. Or perhaps you have to press down to feel it at all because you're not feeling anything with a surface touch to the pulse. Now you can roll your finger on it. Rolling means that you actually move your finger vertically. So you roll to one side of your finger, one side of your fingernail, and you roll to the other. Now, if you ever wondered how babies' pulses are taken by Chinese doctors, they take it with one finger, and they put it on the radial artery, and they roll to the upper pulse, and then they roll to the middle, and then they roll to the other side of the finger to the lower pulse. And still another method, since what we're actually feeling is the motion of pulse through the artery, is you slide your finger over it and see if the vessel is long or if it's short and if it's even as it's beating. So all those kinds of methods were described in ancient times as to how to feel the pulse. Maoist Chinese medicine applying the scientific discipline to Chinese medicine. During the Chinese Revolution, the army under the direction of General Mao Zedong lacked sufficient Western type medications to treat their injured on the battlefield, and that forced them to to experiment and utilize traditional Chinese medicine, and they found it to be quite effective. As a result of that, one of the most famous Chinese formulas today was actually developed in the early part of the 20th century during the Chinese Revolution, and it's called Yunnan Baiyao, and it's the all around trauma medicine. It stops bleeding, it promotes healing, and can even treat gunshot wounds. Because of the success of Chinese medicine with his army, he made a pledge to preserve it and further update traditional Chinese medicine for posterity. We're certainly glad that he did that. But as a result of this, there is a tendency to apply logic and discipline of a type that was really not known previously, scientific discipline, in order to try to find some homogeneous approach so that one person practicing in one part of China or one part of the world could understand a person practicing in a distant part, because the language and the ideas were concurrent with each other. And however, in the 1950s, the same problem of pulse diagnostic studies and people unskilled in it resulted in poor outcomes and consequent lessening of importance of pulse diagnosis. And so most Chinese doctors, even those trained in schools in China, will relegate pulse diagnosis to confirming other diagnostic parameters that are being investigated, such as the tongue, and the most important being interrogation. In other words, what are the symptoms that the people are complaining about? And so after they've understood their assessment based on all those parameters, I'll call the 4 diagnosis, then they would take the pulse to confirm that the diagnosis was correct. So it's sort of a method of both learning and using pulse diagnosis. Here we can see that there's different approaches around the world to the use of pulse diagnosis. Asian healthcare practitioner of 1632, a Western healthcare practitioner. Now you can tell that that's a Western doctor or nurse because he's not using the traditional way of applying the 3 fingers over the radial artery. He's just testing for the number of beats per minute, which, by the way, it's a good exercise for you to do afterwards. And make a note of this, please, if you haven't, if you don't know it. The way you test for the speed of your pulse is you use a watch with a second hand and count the number of beats during 15 seconds and multiply that times 4, and you have the beats per minute. That will have significance and important significance, as we'll learn later on. You see the Ayurvedic practitioner taking the pulse. And then you have the great physician Galen, who was a Roman who practiced Greek medicine, and he wrote a book called De Pulsibus, and he even admitted the struggles in mastering pulse diagnosis. And he says, for many years I was doubtful about clearly discerning the movement of contraction by touch, and I shelved the question until such time as I could learn enough to fill the gap in my knowledge. After that, the doors of the pulse were opened to me. So learning pulse diagnosis is going to be a lifetime effort and a lifetime dedication, and each of us will achieve a certain level of proficiency of it. I can assure you that. Here are the 3 positions, and those of you who are my students should definitely use the Chinese names, because that's what I'm going to be using when we're in class. Zun, Guan, Qi. So Zun is the upper pulse, and it's just at the base of the thumb on the radial artery. The Guan is the middle, and the Qi is the lower. So the Zun gets the index finger, the middle finger gets the middle pulse, and the Qi, or lower, gets the ring finger. There's a whole other system of Chinese medicine that was the first introduction of acupuncture was done by a man named Wordsley, who was teaching in the UK, and many Americans first went and studied Chinese medicine with him. And he taught something called 5-element acupuncture, and it was based on 5-element practice. That was the first anyone back in the 60s and 70s and so forth who was learning Chinese medicine all first learned Worsley's approach. Then the TCM, or traditional Chinese medicine approach, entered on the scene, and many of us found that was much superior and abandoned Worsley's approach. But he based his treatment largely on the pulse, and it was really quite simple, because all he measured was the relative strength of each pulse in each position. So if you are feeling a pulse in the middle finger, and then you're feeling a pulse in the index finger, and you're feeling a pulse on the ring finger, assuming that each of those are going to be proportionally normally different. For instance, the Qi pulse, or the proximal pulse, is usually fainter, it's deeper. The Guan pulse, the middle, is usually stronger and in the middle, and the Zun pulse is sort of in between, but usually higher. So assuming what might be normal, and that's purely as a subjective assumption, after taking many pulses you can do that, you decide that one pulse or another is weaker or stronger in relationship to the other, and then you're comparing it to each hand as well. The Japanese use a system of Kiraku Chiryo. It uses only the 6 deep positions to identify 4 general patterns of weakness. TCM approach classifies the pulse in terms of 28 or so traditional pulse types. Some people say 24, some people say 1 or 2 more, but it's approximately 28, and that's what we will be teaching. Ways that people have tried to represent pulses, both in books such as Western books that are describing pulse qualities to Western physicians, these qualities are these representations are also used in writing pulses, um, books on pulse diagnosis for those who are learning Chinese medicine. So you see the Pulsus tardus. This is a Western name. So this is to show you that Western medicine also recognizes different qualities in the pulse. So here you see the pulse is slower. And then you have the hyperkinetic pulse, which is increased systolic stroke and a large pulse amplitude. And then you have the Bifarians pulse, a pulse that has two palpable peaks during systole. It can occur in any condition affecting heart contractility. Then you have the bigeminal pulse, a variation of the previous pulse, but occurs regularly and is due to premature ventricular contraction following a regular heartbeat. And then you have the dichrotic pulse, which are two pulse waves for each heartbeat, a pressure wave from the heart during systole and a reflective pulse wave from the limbs detecting diastole. Those are just a few of the many different pulse qualities that medical doctors study, and even earlier on, the doctors' trainings during the early part of the 20th century consisted of studying dozens of different pulse qualities. Always keep in mind that the pulse is only one part of the body, and there are pulses throughout the body besides the radial pulse. There's one in the face and the temporal and the carotid artery, the apical artery, the brachial artery, popliteal arteries, and the pedal artery and the posterior tibial. Even in TCM, sometimes the pulses were taken in other places. Now you may wonder, why did everything descend to using only the radial pulse? It happened as a result of the Chinese tendency to not want to touch women in different parts of their bodies. And as a matter of fact, women sometimes were behind a screen when they saw a Chinese doctor, and they would stick their arm through a screen, and the doctor would take the pulse that way. And it was kind of a discreet way of taking the pulse, and as a result, that method had to go through a lot of refining to reach the level where it is the primary method that's used by all doctors today. Some systems of TCM use the pulse as the primary and even the only basis for diagnosis and treatment. I don't necessarily approve of that, and I'm suspect of that approach. My view is that this is more based on the odds that a complex dietary herb program that follows such a pulse analysis is more likely to be beneficial regardless of the pulses. In other words, somebody might give many different herbal programs, supplements, and so forth, and it doesn't make any difference really what the pulses said. And the same applies to other kinds of subjective or quote unquote intuitive diagnostic methods, including kinesiology, iridology, which I did for many years, and other diagnostic systems. So because someone gets a good result from giving them some herbs and supplements, doesn't necessarily mean that the assessment that was done before that was true. And so you may say, well, why study pulses at all? Because sometimes you don't necessarily get a good result from giving those things, and we're always striving to have a much better understanding rather than shooting in the dark in this way. There are four main parameters to consider for pulse diagnosis: the position at which the pulse could be felt, the pace of the pulse, the form of the pulse, in other words, the level of depth and the width of the artery that you're actually feeling, and the dynamic, which is the strength of the jump against your finger, the arrival and departure. To be quite honest, there are far too many variables in traditional Chinese medicine, such as time of day, season, gender, etc., that can affect the most subtle readings of the pulse. so that even with the best practitioners, diagnosis from the pulse alone today is estimated to achieve at best only 39% reliability. Oh, don't go away. There's still a value to the pulse and learning it, and you will find out what I'm talking about later on as we go on with this. So again, to point out the variables that make pulse diagnosis questionable in many ways are the Nanjing, which describes palpating 5 different depths. So imagine putting your finger on that artery that you were feeling before and trying to understand 5 different depths, the very deepest and 4 more above that. Nobody today can do that. There's also variables in terms of the position of the organs. In other words, whether the colon is in the upper part of the right hand, just below the thumb, that's Tsun position, or whether it's in the chip position of the right hand, which is the 3rd position. So the 12 TCM organs have some different placement. To avoid getting totally lost for the forest for the trees, always first identify the basic quality of the overall pulse, and usually this is done in the middle position. Then, secondly, you will notice anything unusual regarding the 12 positions in any other traditional pulse system. Always keep in mind that the pulse is only a part of the comprehensive TCM differential diagnostic evaluation and can at least be used to further confirm an assessment that is nearly complete. So differential diagnosis is something that I think many people do not understand, and it's really a keystone of my evaluation when students are applying for professional membership to the American Herbalist Guild. Do they apply differential diagnosis, or do they use some simplistic idea of naming the, for instance, accepting the name of the disease that Western medicine would give, or using a pendulum because they really don't know, or using iridology, which is also very simplistic. You know, you see a mark here, it means this, and a mark there means that, and so forth. Pulse diagnosis used by itself, it has as much questionable merit as any of those things. As a matter of fact, I've seen Western diagnosis be as questionable in their assessments, even with x-rays and so forth. People are condemned to a technological assessment that oftentimes in my practice doesn't hold up when I start treating them. Whatever was proclaimed by the medical doctor they had or was a condition seemed to have not been relevant because they got over it. And so differential diagnosis means that, you know, apart from feeling the pulse, which tells you about the heart, if you're trying to find out about the heart, you're also going to take into account factors such as a person's complexion and their appetite, and whether they have pains in their bodies, where they are, and you know, what their lifestyle is, and how do they eat. All these things are factored in, and if all these things factor in and keep building a case in one direction, that's what the assessment or diagnosis becomes. Now, that diagnosis or assessment is really, strictly speaking, as it would be in scientific terms, only a hypothesis. Hypothesis means, let's say that what you have is this kind of condition. You have a wind, damp, cold condition, and I give you, you know, an herb like red clover because you have arthritis, which would be a wind, damp, cold condition, and maybe you get worse because the energy is cold that I'm giving you for treating a wind, damp, cold, and that doesn't work. Now, if I diagnose wind, damp, cold, it means I need to give you an herb or a formula that has warming properties, such as cinnamon twig tea or sassafras bark, both of them which are warming and that would be particularly good for that type of arthritis. So this shotgun approach to treatment doesn't always work. Chinese medicine bases its diagnosis on patterns. And so each disease, whether you're talking about a common cold, it's not so common because there are different patterns for each person for a number of different types of colds. If you're talking about headache, there's different patterns. Even in Western medicine, we have different patterns for different types of headaches. So we try to assess a person based on pattern diagnosis in Chinese medicine. Now, once we've made that assessment, it should lead us to a particular Chinese formula that would be appropriate for that condition. Now we have a really great value to pulses because each formula in Chinese medicine has a corresponding pulse. So you can further understand whether that formula is useful for that condition if the pulse that's described and associated with that formula somewhat or clearly matches. If it doesn't match, then you need to ask yourself why and consider the situation further. So that to me is one of the most useful present uses of pulse diagnosis, to confirm the use of a particular formula in treatment. As we talked about, the pulse in each wrist is different, and you don't have to remember all this now. It's easily referred to in other sources and texts, but just to show you that there are these differences. So that the left wrist, the front deep pulse is the heart, and if you and that's where your index would be on your left wrist. And if you lift your index finger up to the more surface level, you're supposed to be feeling the small intestine. Similarly, on the left wrist, you're depressing your middle finger to the deeper level, and you're feeling the yin organ of the liver. And if you raise your finger up to the more surface level, now you're supposed to be feeling the gallbladder. And finally, the ring finger, which is in the third position, the chip position. The deep position tells you about the kidneys, which represent the hormone system, the adrenals. And if you raise your finger to the surface, it supposedly indicates the bladder. And similarly, in the right pulse, the deep position would be the lungs, and the surface position would be the large intestine. And the middle of the right pulse, the guan position, the deep would be the spleen, and the surface would be the stomach. And in the rear position, we leave there only one position, which is deep, and this tells us about kidney yang, or the yang energy of the kidneys. Today, as we said earlier, Chinese pulse diagnosis is evolving, and first of all, the surface position and the organs associated with it are practically not diagnosed at all anymore. Even many schools abandoned using that as a diagnostic indication. You don't necessarily feel the gallbladder by raising your finger up to the surface position over the middle of the left wrist. And however, if you're practicing Wordsley's system of acupuncture still, which many people are, they are paying attention to all these different organs still. But in Chinese medicine now, the biggest evolution has been that on the left wrist, all we feel is for kidney yin, which is the parasympathetic nervous system condition, and all the hormones associated with kidney yin is the parasympathetic nervous system. And in the right position, in the chip position, or the third position, we're feeling for kidney yang. And that's what many schools in China presently teach, and how I presently relate to the positions in the pulse. We can expect these things to continue to evolve. That's the state of where it's at right now. Here you see the anatomy of the radial artery, and that's what you're actually having your finger on. Now, if you're like me and you're just getting introduced to this, you should have the logical question, which is what Mao Zedong was trying to bring to Chinese medicine, logic and discipline. You'd say to yourself, how could there be 6 different organs within an inch and a half on the same artery? I thought about that a lot over the last 30 or 40 years, and I don't know that I have a definitive answer, but I'm going to give you what I've come up with. There, as the blood is going down the artery and into the hand, in the chi position, you're feeling how it's entering into a particular territory. So here you're seeing the force of the deepest level of the body pushing the blood into the position, that 1.5 inch. And so you're feeling it's entering, you're feeling its level, which is where you're noticing how much blood is there, how long is the actual jump or beat, and you're feeling then how it enters the hand or enters into the peripheral circulation ultimately in the third. So there's like an ascent, a leveling off, and then a moving into. And those 3 qualities, I think, may be a hint as to how the organs relate to that. So what are we actually feeling? This was a very famous medical doctor who taught Chinese medicine back in the 1960s and 70s, and I always liked his description. He said that you're feeling arterial pressure. In other words, you're feeling the artery itself. How much pressure is it? Is it wiry? Is it tight? Is it hollow? Is it soft? Is it leather like a drum skin, a soft drum skin, or is it scattered and diffused? You're also feeling the ease of occlusion. It determines the overall force and volume of yin fluids. In other words, how much material is actually in the artery. Is it like just a little trickle of blood in there, or a little trickle of fluid in the artery? So if there's a lot of material in the artery, when you attempt to press more deeply, it will not. It'll be more difficult to actually stop the pulse. Then you're feeling the force. When you put your finger on the pulse, and this is a very, very important one, you're feeling a jump as it hits your finger. And is it a firm, strong jump, or is it just a weak little tap, or is it an empty jump, or is it a soggy jump, or is it a faint pulse, a faint jump? Then you're feeling the flow, the wave, and the pulse contour. In other words, is it rough, or is it surging, room, or is it stirring? I've never done this before, but I'm going to do some silly things now as I try to describe these pulses and use my voice to mimic some of the qualities. So the arterial wall tension has a degree of tension which can be assessed. When it's normal, there are 3 possible causes. There's blockage or obstruction of qi and or blood, when it's abnormal rather. There's an underlying lack of yin fluids, or there's neurological tension on the arterial wall. If you can imagine, the artery is also surrounded by nerves, and if your body is tense, the feeling of the artery is going to also feel like a wire or a bowstring or a tight guitar string, very tense. And so that tells us about anxiety, tension, depression, mental conditions when we have that kind of tense or bowstring pulse. It's good to envision some of the qualities we're going to be describing. So the force of the pulse can be the heart pushing the blood through the arteries, which indicates qi, vital energy. The peristaltic action of the nerves, how the nerves actually contract the artery and continue to propel the blood through the arteries. And nerves on the arteries expand and closes around each pulse impulse. When it's wiry, it indicates greater spasmodic tension, which indicates liver wind. And whether the blood is sufficient to fill the artery, in other words, if there's enough blood in there to actually fill it, indicates blood condition. So I might diagnose anemia if I feel just a little thin pulse. And the blood viscosity, does it just wuggle, 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 move along like that? It describes dampness. So thinking about these four qualities will help you to make an assessment. Now, the pulse can change and respond to various outward stimuli, so that in some instances, it is necessary to study the pulse long enough to gain a better understanding of its true nature. Traditionally, the pulse was taken first thing in the morning and on an empty stomach, which also helped to make for a clearer reading. One of the things that I learned from Bob Flaws and his teaching is to people have difficulty when they're trying to identify pulses and immediately try to understand what they mean. The pulses have no meaning until they're put in context. So Bob Flaws made a big point of saying that the first thing to do is to identify the different pulses. Get an overall feeling of the quality, whether it's big, whether it's slippery, whether it's wiry, whether it's thready, whether it's rapid, whether it's intermittent, choppy, etc. Learn to recognize those larger parameters of pulse diagnosis that pervades the overall quality before you try to understand what they mean, because each one of those things means something different in different contexts. Rate assessment means it's a measure to determine heat or cold. In the normal person, the rates are 60 beats per minute, 70 beats per minute, approximately that. 60 beats per minute or less is slow and signifies coldness or low metabolism. Could be hypothyroid. The exception is an athletic pulse, which is usually slow and would be normal. 80 to 90 beats per minute or higher is a fast pulse, and this signifies heat or inflammation. It could mean that there's an infection in the body, possibly some hypermetabolic function, inflammation, and so forth. Now, while rate is a measure for understanding hot and cold, it's not the only measure there is. So if the pulse is forceful and strong, overly strong and forceful, that also is an indication of heat. If it's large and it's kind of weak and slow, that's also an indication of deficiency. So understanding these different qualities before you actually try to make an assessment of what they mean is going to be a big help in doing this. So we talked about how to evaluate pulse rate, and that's the simplest, and that's the one you should begin with. When I'm counseling people online, they write to me for a online consultation. I try to instruct them how to take their pulse, and to do it 2 or 3 times and write down their number, counting the number of beats per 30 seconds and multiply by 2 to get the beats per minute. So they at least let me know whether their pulse is really fast or really slow, and then I can ask other questions to help arrive at a better understanding. Now, what do people do? What did the Chinese do, for instance, before there was a second hand on a watch, which, believe me, really simplifies things tremendously. So on average, this was done through the respiration method. So during one complete exhalation and inhalation, there should be 2 pulse movements. So during one inhalation, there should be 2 pulse movements. So that 4 pulse movements per one complete respiratory cycle is normal. Thus, 3 or less is slow, while 5 or more is fast. Now that means that you're going to have to sit there with the person and try to watch them breathe, and maybe even synchronize your breath with them. And this may take quite some time, and then start noticing how many times their respiration, how many times they're breathing for each cycle of a complete breath in and out. So it was a lot more difficult. So what are we feeling? In terms of location, we're feeling whether the pulse is floating, superficial, leak stalk, soft, leathery, sinking, deep, latent, firm, or prison, which means locked inside. we're feeling for the rate, whether it's slow or kind of easygoing, leisurely, rapid, or if it's swift or hasty, or moving or agitated. Rhythm. Whenever you see the word leisure, it kind of would denote the normal pulse. So the rhythm is knotted, which means regularly irregular, or if it's intermittent, irregularly regular, hasty or accelerated, or choppy, which means it's uneven. We're feeling for the strength, whether it's weak, excess, flooding, diminutive, or minute. And we're feeling for the form, whether it's large, flooding, scattered, long, short, wiry, thin, or thready. So the basic objective parameters of pulse taking are speed, force, depth, width or breadth, definition, quality of expansion or rise, quality of the interlude between pulsations, rhythm, cadence or gait, its regularity, and its tension. We talked about the meaning of speed, and notice that somebody who's exceptionally fit and a slower speed will occur when with aerobically trained hyper-efficient hearts that can have a slow pulse. Force means the strength of the chi. Now, if it's again, you need to take several pulses to determine what would be a normal pulse for that person, but a strong pulse means more energy and a weaker pulse means devitalization. But an extremely forceful pulse means excess or congestion and heat. Depth. When you press down the pulse to its deepest level, where it just stops and then you come up a little bit, that's your deepest level. Or superficial with light or no pressure, that's called a floating pulse. So if it's stronger in the floating position and when you press down it seems to be weaker or goes away, then that usually is an indication of some kind of a cold, flu, or fever, and it's pretty reliable. So as I talk about these things, I have to tell you another way to learn pulses, which I learned from Ted Kapchuk. He said, rather than trying to think about these pulses in abstract, learn what they are and find a person who you think should have a certain pulse. So if you're trying to find a superficial or floating pulse, take somebody's pulse who has a cold or a flu or a fever. That will be a floating pulse. If you're trying to find what a slippery pulse is, find a woman who's pregnant, because all pregnant women, when they get to midterm, will develop a slippery pulse, and so forth. The width, which means the volume or the breadth of the pulse, is it fine, thready, or thick like a rope? So a thin pulse means blood deficiency, and and along with blood there would also be chi deficiency. But a full and large pulse means fullness and excess. Definition, which is the pulse's contour or outline. Dryness creates a clear, stark outline of the pulse. Softness or fuzziness indicates moisture or wetness. Hard versus soft. Hardness indicates dryness, softness indicates moisture. An atherosclerotic often has hard artery walls. So I remember one time feeling an older person's pulse. He was in his late 80s, and I thought, gee, this guy has a really big pulse, and he's old. I would have associated a lot of deficiencies, and therefore he would have a thin pulse. And most older people don't have thin pulses. They have inflated, weak pulses, and they feel hard on the surface. And that hardness can be empty, as it was in his case, which means it's atherosclerotic. You're feeling a hardening of the arteries. A soggy pulse feels like an overcooked noodle. The quality of expansion or pulsation of the artery. Consider how long each pulsation lasts. How does it rise and fall? Are both the rising and the falling discrete and perceptible? Does one predominate over the other? Expansion of pulsation is a key factor in determining the pulse gait. So when we say consider how long each pulsation lasts, you have the rising pulse. Okay, so you hear the rising. So there you have a rise, and it dies away immediately afterwards. Then you have both rising and falling discrete. Both the rising and falling discrete and perceptible. So you only hear bump, bump, bump. You don't hear it going up or going down afterwards. That's all you're getting. You could imagine that would be a deficient type of pulse. So does one quality, the rising or the falling, predominate over the other? The interlude between the pulsations are relative to the duration of the pulsations themselves. Can the pulse still be felt and maintain some perceptible level of pressure and contour between pulsations, or does it beat and just drop dead? Just completely just. Oh boy, I hope you're not getting a kick out of this as much as I am doing it. But anyway, a pulse that is too weak or scattered in between pulsations can indicate systemic devitalization and insufficient consolidation of the chi. In other words, it can so it doesn't come to a point. Rhythm or gait. Pulse gaits are often described in terms of natural phenomena. So waves breaking on the beach, so the pulse goes boom, wave, wave, or a hollow stalk of an it's empty, or leaping gazelle, 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 or calling ants, 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 ants. So those qualities are different things that are noticed, and some of the comparisons to animals are particularly used in Ayurvedic pulse diagnosis. Regularity is an important factor in the pulse, and as irregularities can point to weaknesses or heart dysfunctions whose contractions generate the pulse. Many heart weaknesses can be chronic or relatively mild in nature and don't necessarily indicate an imminent acute cardiac crisis or major arrhythmia. However, when a weak heart is assessed, it indicates the use of the right types of tonics for that person. So irregularities are of different types. They can be serious or severe, and or less severe. So three basic forms of irregularity. There's irregularity of speed, irregularity of rhythm, and skipped or missed beats. Of these, the last is the most serious and the first is the least. Then we decide, are they regularly irregular or irregularly irregular? In other words, let's go dup, 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 dup. That's regularly irregular. You're having a misbeat, or dup, 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 dup. That's irregularly irregular. So random irregularities are more serious than regular ones. The more frequent irregularities, those of frequent random misbeats, are the most serious. It means a person's chi is failing. Irregularity of pulse force consists of occasional or alternating weak beats interspersed amongst normal ones. So you have dum, 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 dum. So you have, when you're feeling the pulse, it doesn't beat with equal force. Irregularity of speed or rhythm consists of periodic slowdowns. Dum, 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 dum. Or there may be occasional hesitant or hasty beats. Episodes of a racing pulse are commonly associated with heart palpitations. Pulse tension we talked about a bit earlier. It has to do with the nervous system. A healthy pulse should have sufficient relaxation and suppleness without being too lax. Excessive tension in the pulse is more problematic than excessive laxness. A tense or wiry pulse, also called twisted or cord-like pulse in Unani medicine, feels like a tight violin string or bowstring. It's associated either with chronic pain or emotional psychosomatic stress and tension, or it indicates melancholic or depressive conditions caused by liver qi stagnation. That's an important principle in Chinese medicine is moodiness, depression is a condition that's assigned to the liver, and congestion, moodiness or depression means that there's stagnation, and the liver is the organ that tends to stagnate. So we actually use herbs that relieve liver qi stagnation to treat mood swings and depression and a lot of psychological conditions that are common in our high tense and stressed society today. Pulse length is closely associated with pulse tension. If the pulse is often, because a tense pulse is often long and being palpable beyond the cubit and carpal positions. So in other words, when you're feeling the pulse, it feels like it's longer. It's longer in getting to the first position, and it's longer in exiting. And it may also continue on over two different positions, the actual length of the pulse. If the pulse is long, but it's also supple and relaxed, this is not particularly pathological or abnormal. A short pulse is usually felt in one position only, so you can only feel a pulse in one position of the three possible ones in each wrist. And that is a condition of deficiency or lack of vital force. Western herbalism and Western medicine had its own energetic system, which has been abandoned over the last 300 or 400 years. And it came from that guy Avicenna that we talked about earlier, and earlier from Greek and medicine. And it was based on the four temperaments: sanguine, choleric, melancholic, and phlegmatic. So that the hot temperament is a prominent, forceful, bounding pulse, and it represents acute disease. The cold temperament has a slow pulse, and it can be sinking or deep. The wet temperament is a soft or soggy pulse. Remember that wet noodle. A full pulse can be wet or moist and means excess. A full pulse means it kind of like a swollen noodle that has lumps in it. Dry temperament, clearly defined, crisp, hard, or firm. And a thin pulse is also dry and means deficiency of humors. Humors being things like fluids, blood, and hormones and things of that nature. A rough pulse is also dry and is opposite that of the slippery pulse. And a choppy pulse is rough and abrupt and uneven in its impulse and means a blood stagnation or blood deficiency or stagnation. Ayurvedic pulses used to determine basic pulse gaits for the different prakriti or constitutional types. And these are equivalent in Greek and Unani medicine. So the Vata pulse, which is the nerve-oriented individual, the airhead, air person, can be an airhead. In Greek medicine, it denotes a melancholic temperament, somebody who tends to be depressed and introspective. You don't have to be an airhead to be Vata. I'm sorry I made that association, but you can have a Vata derangement, however. It is most often found in the carpal position. It's firm, clearly defined, and often it's thin, and it indicates dryness, which goes along with this Vata condition. And the quality of the pulse means that it slithers like a snake. The Pitta pulse jumps like a frog, and it is the choleric or fiery type of person who has the Pitta pulse. Or a Pitta disease is also going to give this jumping, sharp quality. A kapha pulse, it glides like a swan. And in Greek medicine, it denotes phlegmatic. In other words, a person that has a lot of mucus and phlegm in their system, not just simply coming out of the respiratory system, but just a lot of lymphatic congestion throughout the body and excessive amount of fluid in the blood. Other important pulse gaits are the empty pulse, which is big in width and lacks strength and forceless. It's felt superficially and is slower than normal. So you just go to touch it, and underneath there's nothing there. So it denotes blood and vital force deficiency. A hollow pulse is going to have a more firm feeling to the actual outline of the pulse, but when you press it, it's like there's the again, it's empty. There's nothing there. Now, you should be asking, if you're on top of your game there tonight and not just daydreaming, well, how do I tell the difference between a hollow pulse and a floating pulse? Well, that's where you use differential diagnosis. You don't only tell it by the pulse, you tell it by the symptoms and the way the person presents. And if you have to make a choice between two of those pulses, you then choose the one that's appropriate to the rest of the symptoms. A flooding pulse surges like a wave breaking upon the shore. It's quite big and strong, but falls with less force. It denotes heat that has injured the phlegmatic humor, the serous fluids, and radical moisture. A waving pulse can indicate a weakness of the vital force, possibly a healing crisis. Disappearing pulse is one that rises up clearly and then just disappears. Boom, nothing, nothing, nothing. The outlines of the pulse can also be a little rough and diffuse. It indicates critical deficiency of both blood and vital force. As you can imagine, just envision that you're feeling a pulse and there's nothing that leads up to it and nothing that comes after it. An Unani pulse is called the gazelle pulse. It leaps like a gazelle, and gazelle, and leaps and trails off. Gazelle, gazelle. It indicates heat and fever, possibly pericarditis.
Michael, I
Yes.
have a question about when you're feeling the features of the pulse. Are the questioner asks, are we really feeling the radial artery itself?
Yes.
Mm.
Yes, we're referring to the overall quality that's going to be in the radial artery and on both wrists normally. Now, the 6 positions on each wrist, I said, are of secondary importance, and we just notice them if there's something unusual that appears as we're feeling that. Any other questions?
Um, Not regarding pulse taking right now. There's lots of great feedback about your vocalizations for what the pulses sound like when you feel them. So yeah.
Is it generally helpful?
Oh yes, a lot of people are saying that they're very helpful, and
Oh, good.
yeah, and another one is that you should consider creating a sound mix CD for the different pulses.
That's funny. Well, when we do our seminars in the spring, I develop something called a pulse dance. So I actually have the entire class in a circle move like the pulse indicates. And
Awesome.
that can be quite funny. We have a drum to it, and people just kind of, uh, and if you can imagine yourself dancing like you were a hollow pulse, or dancing like you're a hurried pulse, or dancing like you're going to be an ant. So you can visualize and somatize the pulse and within your whole being. Any other comments or questions at this point? I should have stopped earlier for that because I'm sure there's a lot of thoughts that you have. We have a bit more to go, but we're almost there.
Okay. The other another question is that someone isn't sure that they understand what a wiry pulse is.
Okay, well, the best way to do that is a description that the Chinese give. Imagine you're putting your finger on a guitar string. and or violin string. That's a wiry pulse, and it can be wiry and thin, and it can be wiry and deep or wiry in the surface. All that gives other meanings to. But if the overall quality of the pulse is wiry, it signifies anxiety, depression, and moodiness, and it usually indicates treating liver qi stagnation using formulas like the famous uh, Xiaoyao 1 or Xiaoyao San.
Okay. Oh, and more questions. So
Good.
what? Okay. So I have what? Can you describe with sound effects what a healthy pulse is?
It depends how healthy I am, whether I can do it. Remember, everything we do reflects our condition, and that's really fundamental to all of this. So uh, it's an actor who's an expert actor who can act in such a way that he can reflect the condition of the person that he's representing, and great actors can do that. But normally, uh, whatever we do in Chinese medicine is part of the four diagnosis, is part of differential diagnosis. But having said that, let me see here. Boom, 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 boom. That's healthy. Let's compare some unhealthy pulses. Boop, 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 or another unhealthy pulse. Boop, 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 or another unhealthy pulse. Boom, 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 boom. So you hear all these different distinctions uh, in these that you can make a distinction between a healthy and an unhealthy pulse. I enjoy telling people their pulses are healthy, but if you really strict with all of this, you can always find something abnormal in everybody's pulse. So fortunately, you can reassure yourself that you're not living by pulse alone. That there's other things to you besides just your pulse, and but the evidence that you get from pulse diagnosis is something to take into account, and I think it's very important. An example of that is that whenever I see a traditional Asian person, usually an elderly person, like a woman came to me who was Vietnamese and she was in her late 80s, she couldn't talk English. As soon as she saw me, she didn't want to tell me a single thing about her condition. She just gave me her wrist, and that's what a lot of Chinese doctors automatically do. I evidently was having a good day that day, and I actually diagnosed her right to a T, just from her pulse. Now, uh, it's kind of, I don't know how I can put this. If I say that somebody has spleen deficiency and I detect a little slipperiness in this position, you know, it doesn't have to be a disease, and it's pretty hard for somebody to say, no, I don't have any spleen deficiency. But if they have spleen deficiency and they say, oh yeah, you're right. So there's all of that kind of mystery that goes on with it. if I wind up having only the pulse to diagnose and treat somebody from, and you find that when you go into traditional Chinese pharmacies, typically they'll have many of them will have a Chinese doctor in the back who is basically hears the person's condition and takes their pulse and then writes a prescription. Well, there's the odds are that the prescription is going to be somewhere in the ballpark of doing the person some good, um, based on just learning the symptoms and taking only the pulse. Uh, would it be better if they evaluated the tongue along with it? If they evaluated uh, other aspects of the person's condition, the 10 questions and so forth? Yes, it would be. But There's also great value in the patient seeing the practitioner as having power, and that puts the placebo factors strongly on your side, and that can't be denied. Since all medicine, whether it's Western conventional medicine or alternative medicine, 60% of the results to come are based on placebo, and may have nothing to do with the treatment that's being given at all. I don't like to hear that when I'm having dazzling results with patients, but I also notice when I'm having great results with patients, I usually have a great understanding with that patient, and so I think those things kind of help, and they intersperse with each other. Going on, these pulse spikes that we're talking about are very subtle qualities, which personally I don't even relate to, except that they are there, and someone who is willing to kind of like feel these subtle little spikes or subtle little nuances and wants to know what they are. Well, yeah, there is an understanding of these amongst some pulse practitioners. So in summary, pulse diagnosis is a revered ancient method used by diverse medical cultures, as we've seen, and it's used to assess health and wellness of the whole body, mind state. And it has a basis in Western medicine as well. In other words, there's an objective aspect to pulse diagnosis, which is the relationship to the condition of the heart. And then there's the subjective, the more subjective aspect, which is the individual positions and how they present, which is very hard to prove, but in many cases has some validity. The pulse also serves as a bridge from objective to subjective analysis. It's really a way of the practitioner playing the game of getting to know you. He's shaking hands with the person, unlike this Chinese doctor, because she's a woman. He's not going to shake hands with her. She might think he's coming on to her, and then he would be banned from practice forever. So he's being very discreet. He doesn't look at her. He just touches her pulse very discreetly. It's not reliable as a sole method of assessment, but should be used as an overall part of an overall differential assessment using a number of other diagnostic models. And last but not least, it takes dedication, patience, time to attain a level of proficiency. My suggestion to you is to begin to make it a point to feel 5 pulses every day and write them down. Now, some of you will say, I don't see 5 different people every day. Did I say 5 different pulses every day? No. Feel the same pulses every day. Just get used to feeling the pulse, and when you can throw a different one in there, do that. You find that many times the pulse will change, or your perception of it will change as your understanding grows deeper. So make a point of feeling 5 every day, and over the course of time, you'll get more proficiency. You'll be able to tell when that bowstring or pulse associated with depression and moodiness and anxiety is present. Or you can be able to tell a thready pulse, which suggests anemia and deficiency of qi and blood. Knowing those things makes a world of difference in terms of how you're going to treat that individual, so I hope that you do integrate these into your system. Now, this is part 1 of a projected series of 3 webinars on pulse diagnosis. Parts 2, and probably it'll extend into a third, will describe the 28 different pulse qualities and their significance in terms of Chinese and conventional Western medicine. The dates for these webinars will be announced. I hope you keep in touch with them. And they're free but mandatory for all East-West students. This series of webinars on pulses will culminate with an exclusive 2 full days of pulse diagnosis with Dr. William Morris, PhD in acupuncture, who wrote a very definitive book on recent book on pulse diagnosis called Li Shen's Pulse Studies. And that will be at our next spring seminar, April 26th and 27th. And this class will fill for sure, and early registration by the 31st of January is $250, and afterwards is $275. And call those phone numbers to reserve your place in that course. these are some of the references I used in putting this webinar together. And one that I particularly liked is the last one, Pulse Diagnosis, a Clinical Guide by Sean Walsh and Emma King. The teachings of Dr. Chung are from my own personal notes. And Pulse in the Occident and Orient is a great old book that compares pulses of Western medicine, and many of more than I mentioned, as well as Ayurvedic and Chinese medicine. So I thank you for attending, and that's all for. Are there any other questions or comments that people want to make? I will stay on for a few more minutes.
Well, a lot of people, Michael, are asking if they'll be able to get a copy of the presentation, at the end. And I wanted to let everyone know that we are recording this webinar, so this will be made available for people to view again. So,
good.
Yeah.
All right. Well, thank you very much, and good night.
Okay. Thank you.